It does it. Oh, that's great. Hello. We're starting to come live on all of our platforms. I thank you all. We're finally starting to come on live on all of our platforms. I apologize for the delay. There has been a change to my streaming app since I was last live with you all several weeks ago. So thank you very much for bearing with us for that. I am Dr. DeShawn Taylor, and I am a gynecology and family planning specialist. I am the founder and CEO of Desert Star Family Planning in Phoenix, Arizona. And I am resuming my Well Woman Wednesday series where I discuss topics in women's health every second and fourth Wednesday of the month. October is Pregnancy and Infant Loss Awareness Month. And so I wanted to discuss this topic of early pregnancy loss with you all today. I want to hold space for anyone who will watch this video who has experienced pregnancy loss. It can be a very painful, not only physically, but emotional experience. And there's a lot of stigma that surrounds it, and people don't talk about it very much. So I hope that the information that I provide for you today will help you with any questions you personally may have, or someone that you may love may have, and definitely share if you find this information useful to you. So, a miscarriage is the layman's term for the medical term spontaneous abortion. And so, this is the loss of a pregnancy before the 20th week of pregnancy, and a pregnancy loss that occurs at the 20th week of pregnancy or later is called a stillbirth. Most miscarriages happen because the fertilized egg and or fetus does not develop normally. Now, early pregnancy loss specifically is the loss of a pregnancy before 13 weeks of pregnancy. And so that is the first trimester of pregnancy, the first 12 weeks. Now, 15 to 20% of clinically recognized pregnancies end in miscarriage. And the majority of these are in the first trimester. A miscarriage in the second trimester, which is between the 13th and 19th week of pregnancy, happens about 1 to 5% of pregnancies. And this is likely why we have the tradition where pregnant couples don't share the pregnancy with too many people, right? Until the pregnancy is beyond the first trimester, as the risk of pregnancy loss beyond that is much less. More than 3 million pregnant people experience a miscarriage in the United States every year. Now, during a spontaneous abortion or miscarriage, people may experience abdominal cramping, pain in the lower back or pelvis, vaginal bleeding, nausea, vomiting, and fatigue. And it's important to understand that once a miscarriage is in process, this cannot be reversed. However, there are medications or procedures such as a dilation and curettage, or medications that I'll describe a little bit later that can prevent certain types of complications from a miscarriage. Now, before discussing treatment options, I do want to share some additional terminology with you to help you understand how some treatment options may be preferred over others. Now, when a pregnant person has begun to cramp and bleed and the cervix is open, tissue is visible, and the passage of this tissue is imminent, this is what we medically call an inevitable abortion. This means that the miscarriage is active, and we expect for the pregnancy to pass from the uterus on its own, generally. Now, if all of the pregnancy tissue does not pass from the uterus on its own, Then we have something called an incomplete abortion. Now, again, I'm using the term abortion because abortion is a medical term. It can either be spontaneous, which in layman's terms we call a miscarriage, or it can be induced, which is how people generally think of abortion when the word abortion is mentioned. But abortion is just a medical term. And so when there is passage of some of the pregnancy tissue, but then there is still some fetal or placental tissue that remains in the uterus, then this incomplete abortion needs to be treated. And it's very important that we do something about this to prevent excessive blood loss and or infection from retained fetal or placental tissue. Now, there is another type of miscarriage that has been termed silent miscarriage, and this is diagnosed by ultrasound. Often the symptoms of pregnancy, such as breast tenderness, nausea, or fatigue, continue when a silent miscarriage has happened. A person continues to believe that they're pregnant because they feel pregnant. In some instances, a person might have cramping or some brownish, pink, or red vaginal discharge that accompanies this. But oftentimes, there aren't any other symptoms. And approximately 1 to 5% of pregnancies result in this silent miscarriage. And there are some medical terms for silent miscarriages, and they are anembryonic pregnancy, and meaning without embryo, and then there's embryonic or fetal demise. And so I don't want to get into the nuances of these medical terms. So basically, whether something is termed an embryo versus a fetus is based on how many weeks gestation that a pregnancy is. But an embryonic pregnancy is a pregnancy in which the very early pregnancy appears normal on an ultrasound scan, but as the pregnancy progresses, a visible embryo never develops. And in a normal pregnancy, an embryo would be visible on an ultrasound by 6 weeks after the last menstrual period. An embryonic or fetal demise is a loss of pregnancy after it has developed to a stage where an embryo or fetal structure is detectable on ultrasound, but there's no heartbeat. Now, treatment options kind of vary based on where a pregnant person is in this process. One option is to just watch and wait. As long as you do not have heavy blood loss, fever, weakness, or other signs of infection, you can let a miscarriage follow its own course. Now, this can take several days. Then there's medical management. There's a combination of medications that are used that cause cramping and bleeding to go ahead and expel the pregnancy. Now, most healthcare professionals who treat miscarriage medically use a medication called misoprostol. And this is a medication that softens the cervix, has it dilate a little bit, and then causes the contractions of the uterus to go ahead and expel the pregnancy. This is generally necessary in a couple of instances. One is there's the silent miscarriage that I described, and the person does not want to have a moment of watchful waiting. They just want to go ahead and proceed with removing the abnormally growing pregnancy from the uterus. And so those providers who also have access to a second medication called mifepristone will use a combination of the mifepristone and the misoprostol to help expel the pregnancy from the uterus. The combination of those two medications are more effective than just the misoprostol alone. And then there's surgical management. And so this is what I referred to as dilation and curettage previously. And essentially this is gentle suction used to remove the abnormally growing pregnancy from the uterus. And so medical instrument called a dilator is used to open the cervix up so that the pregnancy can be removed from the uterus. And this often can be done as an office procedure with a healthcare provider's office that's equipped to provide that for you. And so oftentimes the surgical management is something that's chosen in the event that someone's having excessive bleeding during their spontaneous abortion there. And so we want to empty the uterus very quickly and immediately, urgently, so that the person does not continue to bleed and potentially put their life at risk. Another reason to do the surgical aspiration is the person makes that choice, right? They're not having any symptoms. They have a silent miscarriage, and they'd rather just not have the pain and bleeding that would occur by having the body expel the pregnancy on its own. And then another reason for the surgical is that if someone's kind of had an incomplete abortion and there's been some tissue, they thought they may have completed it, they didn't necessarily follow up with the medical provider because they felt fine, and then maybe a little bit down the road they were diagnosed with an infection, then it's a good idea to go ahead and treat with antibiotics and also use the surgical management to remove the remaining pregnancy tissue from the uterus. Now, the loss of a pregnancy can be very hard. You may wonder why it happened. You may want to blame yourself, but miscarriages are common and are not caused by exercise, stress, or sex. Having a miscarriage generally does not mean you cannot have a normal pregnancy in the future. However, there are some factors that may contribute to pregnancy loss, including some medical conditions, substance abuse, and some vitamin deficiencies. One that I do want to lift up today is uncontrolled insulin-dependent diabetes. That in the first trimester can lead to increased miscarriage rates and also a markedly increased risk of major birth defects. Another important thing to lift up is drug abuse, specifically alcohol use and pregnancy, which is very common. These things have been found to cause early miscarriage and pregnancy loss in the later trimesters. So optimizing your health leading up to pregnancy could help reduce your risk of miscarriage. Begin prenatal vitamins 2 to 3 months prior to trying to conceive. 400 micrograms of folic acid daily has been shown to reduce the risk of birth defects that can lead to miscarriage. Folic acid is included in prenatal vitamins. And oftentimes we forget that prenatal vitamins have prenatal in them. And oftentimes people don't start to take them until they're pregnant already. But really it's when you are planning pregnancy, when you have the luxury, right, of planning pregnancy, then you do want to take those vitamins ahead of time. You also want to ensure that all of your vaccines are up to date. You want to review your diet. You want to begin to limit alcohol and caffeine consumption. And if you're using recreational drugs, you want to get yourself on the road to quitting. And so, although in general, we don't talk to people about what they did or blame a person for having a miscarriage, there are some things that we can do, again, to optimize our bodies in preparation of carrying a pregnancy as successfully as possible. And so I hope that you found this information useful. And I want to thank you for joining today. And please share if you found this information useful. And again, holding space for all of those today who experience pregnancy or infant loss, as this October is the month for awareness for this. Hold your loved ones close, and I'll see you on the second Wednesday of November for my next installment of Well Woman Wednesdays. Follow us on Facebook, Instagram, and YouTube so you can receive notifications that we are live for these sessions. You guys have a great rest of your day and week, and I'll see you next time.